Hello, and thank you for taking the time to watch this today. I'm hoping that this will give you all the information you need about the next round of recruitment for the Topol Fellowship. My name's Louise, and I'm the Programme Manager for the Digital Health Fellowship at Health Education England. So what is the Topol Fellowship? It's a 12-month fellowship for healthcare professionals, and it will provide you with the time and support to bring in a digital change and innovation project within your own organisation. The programme will give you all the access to all the knowledge and the skills and different tools really to support you through your project and through your implementation and through the different innovation stages of how you're going to approach a digital project. We'll do this through a series of agile methodology workshops, lunch and learn sessions, there'll be a machine learning course, and we'll also have a really strong online Slack community which will help you with peer support. We'll also be delivering a series of alumni masterclasses where you'll be able to spend time with the alumni of the Topol Fellowship and with individuals working in digital health who have had interesting careers and who can give you some guidance on how to actually navigate through the landscape. So we've done some work looking at the benefits and impacts of the fellowship, and they're really, really huge. There's impacts across the whole of the NHS, all the way from data collection through to better patient outcomes. And what we've seen from our fellows is that people are actually being able to use the knowledge and skills from the fellowship directly in the implementation of their project, and people are delivering digital transformation projects. So this idea of applying the learning that you're getting in the workshops into what you're doing in your day-to-day work really is coming through for the fellowship. So what are cohorts 3 and 4 going to look like? So we're going to be launching in April 2022, and it's going to be a face-to-face launch. There'll then be a core programme, which is a series of workshops and lunch and learns. And as I said, these will be based around agile methodologies within digital transformation. You'll then have your machine learning course, which will come towards the second half of the year. And in between these, there'll be your masterclasses, and we'll be doing 3 per year. Just to give you an idea of the sort of people that we have at these sessions, we've already had Gary McAllister and Dr. Aisha Rahim, who have done excellent talks on their roles in digital health, how they've got there in their career and where they see it going next. That's just to give you a bit of an idea of where these are focused. And then there'll be a final closing conference where we'll get you together, hopefully with other fellows and with previous alumni, and it'll give you an opportunity to showcase your work and your project and what you've done over the last 12 months. From a programme support point of view, there's a lot of support for you in this programme. You have the programme team here at Health Education England, and we'll also be doing one-to-one review sessions with you through your programme. There's also support through our programme delivery partner, and these will be either one-to-one if they're requested, or there'll be some group coaching sessions, and there'll be follow-up sessions after every workshop. There's also coaching and mentoring and access to an alumni network through the Digital Readiness Programme. There's peer support through your own cohort, and this will be through Slack, which I've just mentioned, and there's plenty of networking opportunities with alumni and fellows, which we will facilitate for you as part of the programme. So what will cohorts 3 and 4 look like? There's going to be 30 HEE funded places per cohort and up to 5 sponsored places. So that's up to 70 places in total, all starting in April. As part of that, we will give everybody a £15,000 bursary, which will be paid directly to your employer and can be used however you see fit within your fellowship. So that might be that you want to provide some backfill for your role so that you can have some protected time. But it also might be that you need it to buy some hardware or software to support your project, or even getting some administration support to help you move the project forward. Essentially, that bursary is for you to decide what's best for your project. You'll also get the programme as I've described and the support. In return, we expect employers to make sure that you're given the dedicated time and protect the time needed to actually implement your project. We recommend a minimum of a day a week, but recommend that it's 2 days a week. And they also need to make sure that the £15,000 is ring-fenced and used appropriately to support you through your project. Your employer will also need to make sure that you've got a named project sponsor who will champion you through the project and be able to support you within your own organisation. And this will be considering things such as the governance processes and making sure that you've got the right people in the right place at your organisation to make sure that your project is a success. So applications open on the 8th of November and will close on the 6th of December. We'll be shortlisting through December and then interviews will be in January. All information can be found on our website, so please take a bit of time to have a look at that and also have a look at the stories of our current fellows and alumni. And if you've got any questions, please do feel free to get in touch with us. Just a little bit of information about what the application form will look like. What we want to know about are your experiences and your aspirations in terms of digital health. We would also like you to focus on the problem that you would like to explore. So we're not asking you to tell us what the answer is. What we want to know is what the issue is and how you would like to approach exploring that. We also would like to hear a bit about how the support you're going to get within your organisation, because as I've said, this will be key to the delivery of your project and for it to be a success. So what are we really looking for within the application form? We want to hear enthusiasm. We want to hear from people that are championing digital change and who want to really move forward themselves and their organisations. You'll need to have a curiosity about what your problem is and not just be looking for a direct answer. You'll need to be willing to explore it, to collaborate, to speak to your stakeholders, to think about the people it's intended for and think about co-production. We also want to see where this fellowship fits for your individual career and your career goals. So we would like to hear about that, and we'd like to hear how you see yourself moving forward through this and how it will support you. And we would also like to hear about how the support will be used, so how the bursary will be used, and also how this will support your local organisation and the possible system impacts that you may have through developing this project. So that's what we're looking for through the applications. Really, we want to hear enthusiasm, curiosity, and we want to hear how this fits in with the bigger picture. So thank you and good luck. If you have any questions, please email us. Also, please sign up for one of our webinars, which is available on the dates are available on our website if you've got any further questions or if you'd like to get a bit more of an understanding of what it's like. We'll have some guest fellow speakers at those webinars who'll be able to give you some direct experiences about what it's been like to be a Topol Fellow. Thanks very much.